my name is Kevin. I'm from the UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the back and voice.
You said, I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Shiraldin from Warangal.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I have been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
Treatment the same day. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and today we are live before treatment, and today date is 28 May 2021, and with us Kent is here and he's having some voice problem and he's not in India, so he contacted me for online voice therapy. And please subscribe our YouTube channel so that you can also watch his post-treatment live. So Kent, what problem you are facing? Can you tell me?
So I have a very high pitched voice. My voice hasn't changed since I turned 14. I always carry this voice, and I didn't know my voice is this high until one day when I was on the phone, and that person put me on speaker. From the other side I can hear my voice. I didn't know that was my voice. I couldn't recognize. Okay, because when I hear my voice myself, right, it's different. It's different from when other people hear it. So yeah, so that's when I know I have a very high pitched voice, and then that's the reason. That's how I recognize it. And the reason I reach out to Dr. Sanjay is because I think this thing will be a root block to my career. Okay, because I'm an accountant, so I every day I give advice to people. So sometimes people just couldn't trust my words, because they will be thinking they are speaking to a child. So that's why I want to get this fixed. Yeah.
Okay. So
is that okay? Do you
yeah.
speak?
Thanks for your faith on us, and we'll do the needful. And just I will try to explain. Maybe some of my YouTube channel viewers will be the new at our YouTube channel. So I'll be just trying to explain a little bit of how the normal speech production mechanism and what could be the reason of this high pitch voice, and what we are going to do in the voice therapy. And of course, we'll be treating online voice therapy. So just basic information I'll be giving. And those who are frequent viewers of my YouTube channel, they must be knowing what I'm going to tell for this problem. But anyway, let's move forward. So to understand this problem, let's first understand how the normal speech production mechanism is. For normal speech production mechanism, first thing is the thoughts that comes in the brain. Then we take air. That air goes to the lungs. When we breathe out, we put a air pressure below the vocal cords. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once we put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. For example, if you want to say p, both the lips are coming closer together and touching each other. When you want to say the, tongue is coming between the teeth. When you want to say k, back of the tongue is getting elevated. So each and every sound has own place, own manner of articulation. So when you say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sounds generate, we modify that sound into different sound one after another. And in one sentence, there are so many words. In each word, there are so many sound. Each sound has its own place, own manner of articulation. So in this process, there are hundreds of our body muscles work in a very, very coordinated way. If coordination among these muscles goes, fluency goes. That is another problem. So we'll be concentrating on the high pitch voice. So during puberty, what happened? Mass of the vocal cord, length of the vocal cord changes due to the hormone testosterone. So before puberty, vocal cords will be thin. But after puberty, due to the testosterone effect, vocal cords become thick. So thin vocal cord produces high pitch voice, thick vocal cord produces low pitch voice. So sometime what happened, the child achieve the puberty, and after puberty vocal cords become thick, but still because of their old habit from childhood to puberty, he has spoken in a high pitch voice. So when in the puberty vocal cord become thick, but he will be maintaining his high pitch voice, childish voice, or we can say feminine voice. So when he will talk on the phone, even after puberty, unknown people will think they are talking to a girl or female, and that will affect the confidence also. So in a very simple way, you can understand. Just think about the vocal cord is a kind of a guitar string. So before puberty, the vocal cord string is thin, so it's equivalent to a thin string of a guitar. But after puberty, the vocal cords become thick, so it's equivalent to thick string of a guitar. So thin string produces high pitch voice, thick string produces low pitch voice. So before puberty, there will be no much difference between boys and the girl's voice, because both will be the thin. But in case of boys, because of the testosterone effect, the vocal cords become thick. So vocal cord become thick, then the voice should be low pitch, masculine. But some people, because of their so many years habit, they will not accept the new voice, new vocal cord. Because of the new vocal cord, voice should be like low pitch, but they will be maintaining their childish voice because of their so many years habit. So what I will do as a voice therapist, suppose this is the vocal cord. To maintain the childish voice, instead of vibrating the whole vocal cord, they will be vibrating only thin edges. So if you are vibrating thin edges, the vocal cord is thick but behaving like a thin string of a guitar. So if guitar string will be thin, the pitch will be higher. So I'm not going to change the larynx or the vocal cord. That is not my control. So what nature has given the vocal cord, suppose if this is the vocal cord, and to maintain the childish voice, if the patient or the boy is vibrating, or you are vibrating only thin edges of the vocal cords. So if with the vocal exercise, if I stimulate the whole mass and the whole length of the vocal cord which was behaving like a thin string of a guitar, now will start behaving like a thick string of a guitar. So the pitch will reduce. So this is the basically biophysics of the problem. And you can also correlate if you are from science background and you know the basic of the acoustics, the relation we call n is equal to 1 by 2L under root T by M. Like n is here frequency, L is the length of the vibrating string, and T is the tension, and M is the mass per unit length. So the frequency is directly proportional to the tension, but inversely proportional to the mass and the length. So after puberty, vocal cords become thick, or maybe during puberty, vocal cords become thick. It means mass of the vocal cord, length of the vocal cord increase, then pitch reduces, because the frequency or pitch, we can say that inversely proportional to the mass and the length. So this is so simple. So as a voice therapist, I never change anyone's larynx or anyone's vocal cord. Like what the nature has given different height, different color, the same way the vocal cords are also different. So what I do, what nature has given that vocal cord to use in a most effective way. So that's why if you'll watch my all the videos of YouTube channel, different patient will be having different changes. It's not like that I will be giving extra attention to some patient and less attention to some other patient. If nature has given the sufficient mass and the length, so once I will stimulate whole and mass and the whole length, so pitch will be very, very low if the sufficient mass and the length is there. If nature has given comparatively less mass and the less length, so the comparatively change will be the less. So sometime patient think that I'll be giving the voice. No, voice is the byproduct. I will train my patient to use their vocal cord in a most effective way. So don't mistake me, I'll be giving the voice. Voice comes as a byproduct. I'll be just giving training to use the vocal cord in a most effective way. I can't replace the vocal cord. So that's why all patient will be not be happy. There are some patient whose vocal cord mass length will be given by the nature very nice. So their change will be very nice. So they'll be very happy with my work. And some patient, yeah, it's changes there, but it's not that much impressive. But it's not in my hand to change the vocal cord in the larynx. So this is the practical information and practical challenges. Those who are planning to get treated from me, they should understand. And don't believe on only watching one video. Just try to watch as many videos as you can. And there are thousands of videos. And I started my YouTube channel in year 2010, I think. And from that time onward, we have uploaded almost thousands of videos. And we started online voice therapy in the year 2013. So I think, one of the oldest, I think, and the professional, you can say, in the whole world who started the online voice therapy. One of the oldest, you can say, consider me. And a little introduction about myself. Like many of my patients will be knowing, or maybe viewers will be knowing. My name is Sanjay Kumar. By profession, I am a speech language pathologist and audiologist, and I have studied from AIIMS, Delhi, All India Institute of Medical Science, New Delhi. There I did my graduation in the speech and hearing science, and post-graduation I did in the speech language pathology field from the University of Mysore. And apart from correcting the pitch and the loudness, we also correct at our center dysphonia due to the vocal cord paralysis, stammering speech therapy, and functional aphonia speech therapy, sulcus vocalis voice therapy, spasmodic dysphonia voice therapy. And so if you will explore our YouTube channel playlist, you'll get an idea like what are the communication disorder we are dealing with and what kind of changes you can observe after the therapy. After watching so many videos, you'll get some ideas. So my suggestion is please explore our YouTube channel playlist to get an idea how a certified speech pathologist changes the life of people having communication disorder. So like Kent, maybe some new people have joined. So now it's your turn. So just maybe you can repeat what are the challenges you are facing because of this voice in day-to-day life. So let's people understand.
So I am an accountant by profession. So this is my second years of working as an accountant. So I will be qualified in 6 months' time. So as the time goes on, I think I'll be handling more difficult jobs. That means that I'll be speaking to more people. Okay. So I don't want them to feel like they are speaking to a child, a kid, because as I gain more experience, I'll be dealing more difficult jobs. I'll be doing jobs that involve, I don't know, 1 million, 2 millions, different, the figures just get bigger and bigger. That means that, I want the people, my client to be confident on me, right? It's all money. It's all, I'm dealing with money every day. So I have to be, just sounds like a man, an adult, before I can give the advice, because that will increase their tax or reduce their tax. That's very important. So that's why I want to get Dr. Sanjay to change my voice, to get it deeper. Yep.
Okay. Yeah. Thank you. Very well said. Like what you told. Yeah. So very well you said. Communication is the most important aspect to become success in any career. If you have a confident voice, if you are speaking confidently, then it gives a good impression to your clients, and even while searching a good job, it also impact. And of course, if pitch is higher, if your voice is childish, so sometimes people will not get more confidence in you, maybe the job provider or maybe your clients. So it's very well you said. So I'm totally what you said, I'm totally agree with you. And let me see if any questions are there. Just 1 minute. Yeah, from those who are watching this live. So I will try to give answer in between. So I'm just saying, those who have joined this live, I want to say thank you, everyone. Thank you, Sadanand Pandey. Thank you, Ria Thakur. And thank you, Avinash Suman. And yeah, thank you everyone for joining and watching us. And let me see if any questions are there. I'll try to give answer. Sandeep Pandey is saying hi sir. Hi Sandeep. And Sandeep Pandey is also telling speech therapy lena hai, kahan aana hoga. So Sandeep Pandey, you can go to our website and click the reach me, you will find the details. And Ria ठाकुर is asking, मेरा भाई 14 साल का है, उसका एक्सीडेंट हुआ था 25 अगस्त 2020 के पहले वो बोलता था पर एक्सीडेंट के बाद नहीं बोलता था, बट अभी बोलता है लेकिन साफ नहीं है। तो रिया ठाकुर जी, एक्सीडेंट के बाद मुझे ये पता नहीं है कि इंजरी कहाँ पे है। अगर हेड इंजरी है तो हेड इंजरी के बाद अगर ब्रेन में ब्लड का सप्लाई नहीं हुआ है प्रॉपरली तो स्ट्रोक के बाद एफेजिया डेवलप हो जाता है, या फिर हो सकता है वोकल कॉर्ड्स में डैमेज है, या फिर कभी कभी फियर की वजह से आवाज़, वोकल कॉर्ड भी सही है, ब्रेन भी सही है, सडनली चली जाती है, फंक्शनल एफोनिया बोलते हैं। या कभी तो ब्रेन के कुछ ऐसे हिस्से में चोट लगा है जैसे सेरिबेलम वाले हिस्से में, तो मसल्स न्यूरोमस्कुलर जंक्शन में वीकनेस आ जाएगी, तो स्लर्ड स्पीच डिसार्थिया बोलते हैं। तो हम चाहेंगे कि आप उनसे बात करें, पेशेंट से एक बार बात करना चाहेंगे, और हमारा कॉन्टैक्ट डिटेल हमारे वेबसाइट पे है, फिर हम लोग अकॉर्डिंगली गाइड कर पाएंगे। तो हम अभी कह नहीं सकेंगे कि एफेजिया है या डिसार्थिया है या फिर और दूसरा कोई कम्युनिकेशन डिसऑर्डर है। तो आप हमें कॉल कीजिए, हम सुनेंगे, समझेंगे, डिस्कस करेंगे प्रॉब्लम को, फिर गाइड कर पाएंगे रिया ठाकुर जी। और ये राहुल के सुरेश लिखते हैं, हाय डॉक्टर। हाय राहुल के सुरेश, यू कैन ऑल्सो टेल मी SLP Sanjay Kumar. I'm a speech language pathologist and audiologist by profession. So, and Muhammad Danis is written, मुझे थेरेपी लेनी है। Yes, Muhammad Danis, you can go to our website www.speechtherapyindia.in. Click the reach me, you'll find contact details, and contact us by email, by phone, or by physically. You can reach to our clinic after 6th June. Because of the lockdown, the clinic is closed till 6th June. And so next is Muhammad Danis is saying, high pitch voice problem. Yes, Muhammad Danis, first we'll try to do the perceptual evaluation, and then accordingly we will be able to guide you. So thank you for asking question, Rahul K. Suresh, Muhammad Danis, everyone. Thank you so much, everyone. And about our contact details, please refer our website www.speechtherapyindia.in. So thank you, Kent. Thank you so much for joining. If I'll be no question, we can stop this live. And yeah, and again I'll be suggesting please subscribe our YouTube channel, and so that you can watch the Kent's post treatment live, and even you can also explore more videos pre and post. There are some old videos, so you'll get an idea what kind of services we provide, and you will also develop hope if you have a communication problem, especially if you have a high pitch voice, loudness issue, dysphonia due to the vocal cord paralysis, suddenly complete voice has gone. We call it functional aphonia. Very interesting to treat that patient. Patient will not be having any voice, and after treatment, once he get the voice, there are some emotional videos of a functional aphonia. The guy came from the Africa, so that also I will suggesting you can watch. And yes, of course, thank you everyone for joining us and watching us. In the last, Kent, tell again about yourself and your problem, what challenges you are facing.
What are the challenges that I'm facing? Okay. So I spoke about how it affect my career. Okay, so I think not just career, right? In your in my day-to-day like when I go out with my friend, like when I trying to speak to a group of people, it's really hard to get attention from the people, with a very high voice, because everybody knows a high voice is annoying. If you ever heard of a voice, if you ever scratch the whiteboard, right, a blackboard, the sound, that's annoying, right? So it's the same here, right? If you have a very high pitched voice, it just annoys people. That's why I think, like when somebody is trying to outspeak you, okay, it's very hard to get back the attention. Okay. But when you're talking to a group of people, 3-4 people, yeah, that's my challenges as well. Yeah.
Okay, so thank you so much, Kent, for coming live with me and talking about your challenges. Maybe those who are having similar problem, they will also get an idea. And once we'll make after voice therapy live also, then people will get an idea what changes was able to do.
Yeah.
And thank you so much, everyone, for joining us, and thank you, Kent, so much. So we can stop this live. And before that, I'll be seeing any question is there or not. Otherwise, we'll stop. Yeah, there is a question, Gopal Kumar, fumbling and blocking, how to overcome. So Gopal, we will want to do the perceptual evaluation to understand your problem. So please call us and then we'll be able to comment on the issues. Thank you so much, everyone. Thank you so much.